Please, if you know someone who is pregnant, I'm begging you, share this video with them. Because there is a complication that could take both their life and their babies at any moment if it goes unnoticed. It doesn't always cause pain. It doesn't always scream for attention. But when it appears, it can progress fast, and it can be devastating. It's called preeclampsia, and it has turned many healthy, normal pregnancies into emergencies. Babies born too early, mothers in the ICU, some never make it home. Please don't click away, because in the next few minutes, you'll learn what preeclampsia really is, how to spot the early warning signs, who is at risk, and most importantly, how to protect yourself or someone you love from becoming another silent tragedy. Are you ready? What exactly is preeclampsia? It's a pregnancy complication marked by sudden high blood pressure, along with signs of damage to organs, most commonly the liver and kidneys. It usually shows up after 20 weeks of pregnancy, but it can appear earlier or even after giving birth. And here's the scary part. Many moms don't feel anything unusual. It hides until it's urgent. So what are the early signs of preeclampsia? Please remember these 6 red flags, because they could literally save your life. High blood pressure, especially if it's your first time experiencing it, or if it reads above 140/90 mmHg. Severe headaches that don't go away with rest or medication. Vision changes, blurry vision, flashing lights, or seeing floaters. Pain in the upper right abdomen, right under your ribs. Nausea or vomiting. That doesn't feel like typical pregnancy nausea, especially in the 3rd trimester. Sudden swelling in your face, hands, or feet that seems more than usual pregnancy puffiness. You don't need to have all of these. Even one concerning sign is enough to call your doctor right away. So why is preeclampsia so dangerous? Because if left untreated, it can quickly lead to seizures, also known as eclampsia, which can be fatal. Liver or kidney failure. Placental abruption, where the placenta detaches too early. Intrauterine growth restriction, where the baby stops growing. Stillbirth emergency early delivery or C-section. And in worst cases, death of the mother. Preeclampsia isn't random. There are clear risk groups, and knowing if you fall into one can help you and your provider stay ahead of it. So, who is most at risk? Check if you or someone you know falls into any of these categories. First pregnancy. Carrying twins or multiples. Personal history of high blood pressure, diabetes, lupus, kidney disease. Previous preeclampsia in another pregnancy. Obesity, BMI over 30. Age over 35 or under 18. Long gaps between pregnancies. Less than 2 years or more than 10 years. If any of those apply, talk to your doctor early in your pregnancy. And make sure your blood pressure and urine are checked at every prenatal visit. Now here's something most people don't know. Preeclampsia doesn't always end after birth. Some moms feel safe once the baby's out, only to collapse days later from postpartum preeclampsia. If you've recently delivered and experience severe headaches, high blood pressure, swelling that gets worse, blurry vision, or chest pain, don't ignore it. Go to the hospital immediately. This is still a high-risk window. So, how can you prevent preeclampsia? Monitor your blood pressure at home, especially if you've had issues before. Eat a balanced diet, less salt, enough protein, and lots of vegetables. Stay physically active, gentle walking, yoga, or whatever your doctor recommends. Manage stress and get proper rest. Take low-dose aspirin if your doctor prescribes it, especially for high-risk women. Never skip prenatal checkups. Sometimes the difference between a safe pregnancy and a crisis is just one missed appointment. Let me tell you a true story. It might give you chills, but it's why I made this video. Mai, 32 years old, pregnant with her first baby. Everything seemed fine. At 35 weeks, she had a headache. Her vision was a little off. She thought it was just stress from work. 2 days later, she collapsed in the bathroom, seizing. Her family rushed her to the hospital. The doctors performed an emergency C-section. The baby was born at just over 2 kilos. Mai survived, but spent 3 weeks on dialysis due to acute kidney failure. She later said, "I wish I knew that headache wasn't just a headache. I would have gone in sooner." I know. When you're pregnant, your mind is already full of worries, and the last thing you need is another one. But preeclampsia doesn't wait. It doesn't discriminate. It comes when you least expect it. But when you're informed, when you listen to your body, when your care team is alert and proactive, you can be safe. Your baby can be safe. You are not overreacting for asking questions. You are not a burden for being cautious. You are being smart. You are being strong. You are protecting life. If this video helped you understand preeclampsia better, please share it with someone who's expecting. One message from you could be what saves their life. Subscribe to this channel for more evidence-based content on pregnancy, baby care, and postpartum recovery.